Pressure injuries is a buzzword in nursing, but oftentimes we're not given the education or the structure to adequately prevent these. This changes now. Hey, my name is Nurse Key, and welcome back to New Nurse Bootcamp. So, pressure injuries is not just about skin, it's actually about blood flow. They don't just happen suddenly, it's when pressure overrides perfusion. So, pressure, or as we call it in the hospital, a hospital acquired pressure injury or pressure ulcer, a bed sore. These are all the same interchangeable terms. And it's basically a wound that's created by prolonged pressure on one part of the body. Pressure, prolonged pressure, decreased blood flow, the tissue breaks down, the tissue now opens, and now we have a wound there. So there are certain high risk areas that each patient with a pressure injury can have, which would be the sacrum, which is like at the back with your tailbone, your heels, right? Because when people are laying flat, anything that actually comes in contact with the bed can have a pressure injury. So that could be your head, your tailbone, your heels, your elbows, and even your hips. So there's a few things that put people more at risk for a pressure injury. Obviously, this wouldn't be like a walkie-talkie patient that's independent, able to reposition themselves with their own cognition, but it would be somebody that's immobile, whether that's from trauma or surgery, or they're bedbound or chair fast. Somebody with poor nutrition, right, because their skin is already kind of thin and doesn't have a lot of muscle to protect them from breakdown. Moisture, like incontinence, urine, stool, or sweat. This is why incontinence care and just general hygiene care is essential because moisture, it breaks down the skin if left on for a long time. Decreased sensation. So sometimes the patient not able to tell you that they're wet or that they need to turn because it's hurting them. They just lay there. Poor perfusion to those areas is kind of the same thing with sensation. They're not getting good blood flow, so not able to tell, or it's that tissue is already susceptible to die. And then long OR times. The longer the person is in surgery, they're generally in one position, so that can lead to skin breakdown as well. So Haffy's is generally not the cause of one problem. It's based off of a cluster of different things. So as a nurse, it's important that when you think of certain things, it's going to trigger you to think, hey, this patient is more at risk for pressure injury. So like I said, if that person is immobile or total care, you're going to think, hey, we're going to turn every 2 hours. Generally, some facilities do have turn teams, but in most places, that's not realistic. They don't have turn teams, so you are required to turn your patient every 2 hours. And then also, it's usually left or right, not usually on the back, so you just turn them from left to right. And that counts as a turn. Now, a full turn is like their whole side has to be off of the bed, heels floated, butt floated off the side of the bed. That constitutes as a full turn. So that side of the body can have like a little 2 hour break. You're going to check the skin just to get a baseline. Check the skin, check the back of the ears, back of the head, heels for any skin breakdown, skin open patches, or if they already have a wound, you want to see how it's progressing. Don't be afraid to open those dressings and see what's up under there. You're also going to want to document anything that you found, take a picture of it. Depending on your facility's protocol, take a picture, document it, and then say what it is. Most facilities don't want you to stage wounds or pressure injuries, but you can at least just document what it looks like, the size of it, if there's any drainage, does it have odor, the color, the temperature, or anything else that may apply to that exact wound. If it's a moisture care issue, like if this person is incontinent or they're prone to being like extra sweaty or they have discharge or anything like that, you're going to want to make sure that you have like a barrier to that moisture to prevent skin breakdown. So that could be like barrier cream, which is like zinc, or just depending on your facility, it could be a powder, or you could even have the I forgot, is it dry seal? It's like a certain cloth or fabric you put in the folds, like abdominal folds underneath the breast for moisture control. And if they're really bony, you want to start supporting like the bony areas, whether it's the heels, the hips, The sacrum area, you'll put a Meplex or border dressing to give like that area a little cushion. Also, nutrition is important, and sometimes we don't talk about nutrition enough for pressure injuries. You want to make sure that they get enough protein. Some facilities they'll prescribe ProSource. Sometimes they'll have the supplements. Make sure they're having adequate nutrition, whether it's Boost or the Reno version. Specialty mattresses like the low air loss mattresses, or even some mattresses that reposition them for themselves. Some mattresses can turn from left to right, but you still actually have to prop them off to get like adequate turn. And then the boots, the Prevlon boots, to get their heels offloaded of the bed. So of course you have to document all of this, that you turned the patient, that you did try to protect their bony promises, they have nutrition, any current wounds or possible wounds. Like if you see like, okay, it's starting to get unblanchable in one area, you want to document it. And then also report it to wound care. You could probably put in a wound care consultant depending on your facility, but move the patient, get them offloaded, reposition every 2 hours, and save the skin. A lot of things are preventable if you just know what steps to take to save your patient's skin.